Hello everyone, welcome to my channel Ophthalmology Exams and Viva. And today we are going to touch upon Squint series part 3. In my previous videos, we discussed framework for classification of squint and flowcharts for evaluation of squint. If you haven't watched those videos yet, I highly recommend that you watch them first. Links are in the description below. Get ready for today's class, full of flowcharts and tables. Help you remember the topic easily and write in exams effectively. Assessment of visual acuity in children, which is a very important part for evaluation of squint. So first, let's start with the framework for today's class. So before we dive into the topic, let's first look at the framework of what we are going to cover. Now, why are we learning visual acuity in children? First of all, it is very important for long answer question in your exams. Second thing, it is a very important step in evaluation of squint as well. That this video is actually a continuation of our squint evaluation series. Now let's learn evaluation of visual acuity in children in 6 simple steps. We will briefly understand definition of visual acuity. As I've always told, start your answer with definition, then components, then we'll discuss the development of vision, then age-wise evaluation of visual acuity, then what are the tests and what age, what tests are done. So this is how we are going to do, and in the end we are going to discuss Viva pulse also. Start. So when you start with definition, it is important that you define both vision and visual acuity. So vision is what? It's a combination of all these: light sense, form sense, contrast sense, and color sense. Whereas visual acuity is mainly a measure of form sense or spatial resolution of eye. Now this has been mentioned in part sense that visual acuity is a measure of spatial resolution of eye. So spatial resolution is nothing but the ability of visual system to resolve 2 points separated in a space as distinct objects. So that is visual acuity. Now there are certain components of visual acuity. So we divide it into 4. That is minimum visible. Now minimum visible is like whether that object is present or not in an empty space. So that is minimum. So whether a dot or a line is present or not. So that ability to determine whether that object is there or not, present or not, is minimum visible. Next is minimum resolution. You remember it as S for S, that it is separable. So as we discussed, to discriminate two spatially separated targets. So this is the main function of genus cones, and for this normal angular threshold is taken as 30 seconds to 1 minute of R. And most of the visual acuity tests like Snellen's chart, Landau chart is based on this minimum resolution angle. What is minimum recognition? That how do you recognize that letter? So it is combination of spatial and cognitive, and minimum angle required is 1 minute of R. Now what is minimum discriminable? That is the 4th component of visual acuity. It is also called hyperacuity. Now why it is called hyperacuity and not normal acuity like others? So as we know, human eye is capable of seeing more than the retinal cones to resolve. So this is called hyperacuity. Now this is due to higher cortical centers, right? So here cones and higher cortical centers both are working together to see extra in other way. So there are 2 types of acuity: vernier acuity and stereo acuity, which comes under hyperacuity. Now this is very important because in Viva, what is hyperacuity? What is the difference between vernier acuity and stereo acuity? So you should know that stereo acuity is a 3D depth perception, mainly for depth, but vernier acuity is a very small offset of a line that can be detected, right? So mainly ability to determine whether or not 2 parallel straight lines are aligned in frontal plane or not, right? Like this. So you can divide it that way. So this is how you write about components of visual acuity. Now for next step, for development of vision or milestones, visual milestones. For this, you have to follow this table. And now this table includes only the important parts starting from birth to 6 years, which are generally expected in theory while checking and examiners ask in Viva. So this part is very important for Viva and theory. Rest few things you can still forget, but you cannot forget this part, right? So at birth and 1 week, you just remember that only the light perception is there. The infant fixes the eye at a light which is held at 8 to 10 inches away, and that too momentarily. Now this I have taken from Parsons. So mostly these things are from Parsons. By 1 week, start following only horizontal objects, because horizontal is easy to see side to side. So it follows horizontal objects. So optokinetic nystagmus and vestibular eye movements are there. So this I have taken from Parsons, that perceives stripes of 2/5 of an inch wide at a distance of 4 feet by 1 week. By 1 month to 2 months, or 4 weeks to 8 weeks, you remember as F, that he starts fixing also, he follows completely horizontal as well as vertical, and fusion is also there. Then by 4 months, for 4 you remember far. So far, F, that foveal differentiation, and A, accommodation. So both are completed, and recognition pattern is there by 4 months. So 4 for far, you remember. Now by 5 months, this meanness reflex becomes, it is present because the visual cortex has matured enough to process the threat, right? So you make the baby comfortable, you ensure attention with a toy or something, and then you cover the opposite eye, right? And then you quickly move your hand towards the eye, make a threatening gesture, right? And there is a blink response. Before that, the child is not able to perceive this threat, but by fifth month, he can have meanness reflex. By 6 months, stereopsis starts. So by S for S, so you remember as S for S, 6 months for stereopsis. So fixation is there, follow fusion is there, and stereopsis is there, which I have told you the 3 grades of binocular single vision: fusion, right? Fixation, simultaneous perception, fusion, and stereopsis. Stereopsis starts by 6 months, right? Fusional convergence is there, but it is important to remember stereopsis. By 3 years, vision is 6/6 vision with contrast sensitivity. So the child develops vision by 3 years, but actually the normal resolution like adult vision, it comes by 6 years, and stereopsis also get well developed by 6 years. So you remember for stereopsis that it starts by 6 months, but it is well developed by 6 years. So 6 months stereopsis starts, but by 6 years it is completely formed. Now this is important to remember, right? So what are the important Viva questions here? Out of this, anything could be asked, but now ultra important questions are that when is the fusion develops? This is important that you remember. Then where is the foveal differentiation starts? It starts after the birth. Then accommodation, they are very fond of asking accommodation development. Then stereopsis, so it starts by 6 months but forms by 6 years. Now they are very, they confuse you that adult vision comes by what? So you say 6/6 vision? No, you say that it develops by 6/6 vision by 3 years on test, but the actual adult vision with normal resolution, it comes by 6 years. So if you see till here, the binocular single vision is developed. So the formal tests which are required for testing of vision can be done after 6 months of age, and 6 months is the final age where the normal resolution of visual acuity develops. So this is very important to remember. So grossly, if you can remember that at birth the vision is 6/120, at 1 month by 120, by 2 months it goes to 6/60, by 6 months it comes to 6/30 on Acuity cards, right? Or on VP, the vision is 6/6. On, if you test VP, visual potential test, then the vision is 6/6. But if you check on Teller Acuity cards, it is 6/30 only. So by 3 years, the vision is 6/12 to 6/6 on Acuity cards. By 6 years, it is 6/6, just like the adult vision, without any reflective error. Now, so this I have already told you. Now this is very important that you mention in exams also, and you remember age-wise vision. Now, what is another important thing is that visual system has two periods. One is sensitive, that is up to 8 years. So sensitive period is the period of visual system where the visual experiences, they are important for visual pathway and visual cortex. Among this period, up to first 3 years. Now, first to 3 years are critical period. Means the visual system is highly plastic and can be modified by visual input. So this is very important that 8 years तक सब ठीक है. This is a sensitive period, but out of this, first 3 years are more important. Any abnormal visual input during this period can cause amblyopia or squint or deprivation amblyopia. Now, sometimes examiners use these two words interchangeably. Sometimes they ask what is the critical period of eye diagnosis. So they want to listen to up to 8 years, and they ask the peak plasticity, right? So they want to listen to 1 to 3 years. So you have to judge the examiner and decide your answer accordingly. Test. Now, as we know, there are components of visual acuity. So we have divided the test into detection test, recognition test, and resolution test. Now, for this, you just remember this flowchart. So for detection test, you can remember it as CD. So these are the tests you need to remember. And one most important test is cat for drum test, which you cannot miss. Among recognition test, I have divided these into direction based, letters identification based, picture identification based, behavioral pattern, and others. That you how do you recognize the letters or pictures or behavioral pattern. Then resolution based, there are three important tests, and this part is very important because examiners ask this in Viva as well. So optokinetic nystagmus test, preferential looking test. Now, what are preferential looking tests? There are three types of tests: 2 AFC, 2 alternate forced choice test, Caller's acuity test, and operant preferential looking test. And third is VP. So these tests are very important to remember. And now let's see at what age what test can be done. Remember this flowchart. So I have divided it into infants. You can take up to 1 month to 1 year, and then 1 to 2 years, 2 to 3 years, and 3 to 5 years. Now sometimes the question is asked as that how do you do visual acuity in preschool children? So you remember that preschool is from 1 year to 5 years, and you have to mention all these tests from 1 year to 5 years, right? And if they are asked in infants, you mention the first part. So you remember this chart and easy to go, right? Want me to explain each and every test? Please write in the comment section, and I will make a separate video for that. This chart in exams in just 1 minute. Viva also, this chart you cannot forget. An important tests are CAT4 drum test, Cardiff acuity card test, then preferential looking test. Please mark, infants के तो सब पूछ लेते हैं. They ask indirect assessment test also in the form of reflex response or fixation and follow. CSF, you remember CSF? If you have not seen my evaluation of Squint video, please see, because there also I have given a beautiful flowchart to remember evaluation of Squint. Right? So we have covered all these 6 points. Now let's see you remember or not. So for definition of visual acuity, you mentioned about vision also and visual acuity also. For components of visual acuity, I told you about the flowchart divided into 4 parts: visible, resolution, recognition, or hyperacuity, right? So you remember this, and I have given diagram for each part. For milestones and development of vision, I have given you this table. Just remember this. Then visual acuity age-wise, I have given you another table. You remember this visual acuity test. Now this flowchart is very easy when you know the names of the test, and visual acuity test age-wise I have given you this flowchart. Just with the help of flowcharts and tables, you are good to go with visual acuity in children, right? And wow, you are now very much aware of at what age what test should be done. So if the question comes in exam that if there was a 3-year-old child or 4 months child or 5 years old child or a preschool child, I think now you can classify test for visual acuity for this age group very distinctly. Right, in exams, the way I have told you, you are not going to lose marks. In fact, in Viva also, just say this thing, tuck, 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 and I think you will ace. Tuck, 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 and you will definitely do better than today. And after my class, you are not going to forget about visual assessment in children. Right? If you find my video useful, like, share, and subscribe to get more structured learning from me. See you in the next video of Squint series part 4. तब तक के लिए